Okay, welcome everyone. Today's webinar is Simulation Excellence Using Healthcare Simulation Standards of Best Practice by Dr. Penny Watts. Dr. Watts is the Assistant Director for the Office of Interprofessional Curriculum and Associate Professor and the Director of Simulation at the University of Alabama at Birmingham School of Nursing in Birmingham, Alabama. Her clinical expertise is in critical care and ER nursing. Dr. Watts has been in nursing education for over 20 years and currently leads interprofessional initiatives for the University of Alabama Birmingham campus and the nursing simulation program at the School of Nursing. She has expertise in designing IP experiences for curriculum integration and faculty development and IP education and simulation with an ongoing passion in teamwork training. She chairs the SSH CHESI Advanced Subcommittee and the Anaxel Standards Committee and also serves these organizations in other ways. Welcome, Dr. Penny Watts.
Happy Simulation Week, everyone. I'm so glad to be here with you today. My name is Penny Watts, and I'm currently the Director of Simulation, as well as the Associate Director for Interprofessional Curriculum at UAB School of Nursing and on UAB campus, and it's a pleasure for me to be here. I'm also the chair of the Anaxel Standards Committee, and today my presentation will be on simulation excellence using the healthcare simulation standards of best practice. And I'm going to talk about those as we move forward today, but I'm so excited to be here with you this week and sharing in our celebration of our community. So today I wanted to talk about a few things. First, describing strategies for simulation excellence through integrating the standards of best practice, and I'm hoping I can give you a few practical tips to have those standards integrated within your program. Also, I would like to talk about the rebranding and development of the standards as well. I also have no disclosures or conflicts of interest today as we move forward. First, I want to dedicate my presentation today to Dr. Chad Epps. I was so fortunate to work with him the last 10 years at UAB. He's been gone from UAB probably 5 years or so, or maybe a little bit more. And as most of you know, he passed away in December of 2020. And I have to say, he was a mentor extraordinaire. If you knew him, you know exactly what I mean. I also, when I think of simulation excellence and quality for patient safety, I think of Chad. I can't think of anyone else who exemplifies really aiming towards excellence, doing your best in simulation, not perfection by any means, but striving to do our best within the simulation community in making the experiences the best for our students, as well as for our staff, hospitals, independent simulation centers, interprofessional groups, interprofessional simulation centers around the world. Chad was one that pursued excellence through his work in the society, as well as with accreditation. He was an enormous supporter for the standards of best practice, and we would have multiple conversations about them and always advocated for them in different groups. One thing about Chad was his passion for simulation. And what drove him, of course, was patient safety and a situation, of course, with his sister that touched him many, many years ago. So he had a why for his work in simulation and why he really drove in all of his teaching and all of his work quality and excellence in simulation. And I owe a lot of my career and the things that I've learned and know about simulation. I still have much to learn from Dr. Epps. And so today I wanted to present to you the standards. And a couple of years ago, I called Chad and I said, hey, I've been asked to be a keynote speaker at a regional alliance meeting. And I said, could you chat for just a little bit? And so Chad said, of course, let's hop on a Zoom. So I hopped on a Zoom call with him and I said, I need to give this keynote presentation, which I had not done. And I knew he had traveled the world and presented everywhere. And so as we talked, he said, so you have to think about what your passion is. He said, I know you're passionate about simulation, but what other passions? What is something about you? What is something personal that you can relate to simulation? I thought for a minute, really didn't have any ideas. Besides, I like the beach. I like the water and the ocean and the sand. And he said, you love to fish, right? I said, yeah, I do like to fish. And he said, choose fishing as your story when you present whatever you're presenting on the standards, he said, use simulation in reference to fishing as your story. And so today, that's what I am doing. I'm going to connect a little bit of my fishing passion to my simulation passion and pull in the healthcare standards best practice. So first, I want to talk a little bit about my start in fishing. So as a child, I spent much time with my grandfather, Harry, who is Daddy Harry, who is on our screen. And that's me as a very little child. And we spent much of our time fishing. There was a pond nearby. We would go to the ocean on family trips, and we would have a house on the bay, and we would go out on a pier and we would fish. We did all kinds of fishing. We would fish in ponds and lakes, and it was always a different type of pole, whether it was a cane pole or a small reel, different hooks, different bait we would use. We would go from crickets and worms to squid, cutting up squid, fishing in the ocean. And so I learned a lot from him. He taught me so much about fishing in that realm. Now, it's been quite a while since I fished as a little child. So as I grew, excuse me, I still fish. As a teenager, as a college student, I like to fish. Didn't get to do it a bunch, but I did like to fish. And I was a pretty basic fisherman back then. And I really didn't like to touch the fish. That's a whole nother story. But I was pretty basic. I learned some things. I knew some things. I used bobbers, quarts, worms, all those types of things. But I thoroughly enjoyed fishing because I didn't really know what to expect when I would go fishing. So over the years, as my husband and I, we've been married 30 years now, we've always loved fishing and always wanted a boat and a place at the beach. And so the last couple of years, our dream came true that we were able to purchase a boat and we're able to fish a whole lot more. And my favorite is offshore fishing, deep sea fishing. So we have a little condo down at the beach in the Gulf of Mexico. It's on the bay, and we have a boat now. So for a couple of years, we have enjoyed fishing offshore. And some of my favorite gifts and things that I've received, I have to say, are related to fishing. So of course, here you see the boat that we bought, and my husband, as I call him, the fish whisperer, he is there as well. And me and my fishing gloves, which allow me to touch the fish, as well as a fishing pole, also different types of tackle and reels and those type things. So I learned a lot about fishing in that it depends upon what kind of fish you're going after. Are you going after red snapper? Do you want to catch amberjack or redfish in the bay? Do you want to catch triggerfish? So there's so many different types of fish. There's different types of line and braid. What pound test line do you want? Do you need an electric reel? Do you need more drag, less drag? I mean, it is so complicated, and I've learned quite a bit. I wouldn't say that I'm an expert, but I've learned quite a bit over this past couple of years working with my husband. We spend a lot of time watching videos on fishing, Googling, learning from others. We've joined sort of this fishing community where we share ideas and hey, what worked for you last time? Using coordinates in the ocean, like where do you go where there's structure, where there are certain types of fish? So over time, I have learned quite a bit about this from my husband and the community, and that there are so many different things and strategies you can use to catch the fish that you want. So as I've gotten better, I wanted to show you this picture. So this is my husband and my son-in-law, my son, and we went fishing. This was about 2 years ago. And so far, you notice the really big fish right above my head? Yes, that was my fish. And yes, I caught him by myself. And you noticed it was the biggest one. And I'm there with all these guys. So I was very proud. But this group really cheered me on. They coached me every step of the way as I was reeling in this fish. It was about a 25, 26 pound snapper. And I'm getting stronger every day to catch those fish. But I learned so much that day, but I was so supported by my team here that helped me be successful. And afterwards you talk about, well, it might have been helpful to do this. It might have been helpful to do that. So another great a couple of pictures of my fishing adventures. I caught a really big redfish right off the pier as I was fishing with my son-in-law, Benson. And then, of course, one of my other bigger fish is an amberjack that I caught by myself. And it was so exciting. You never know what you're going to get when you fish and you drop down your bait. If you're fishing off the bottom or anything, you never know. You try different depths, different bait. I actually caught a shark before, really didn't enjoy that adventure. We cut the line and said no thanks. But I do keep learning more and more about fishing. And I think this really correlates to simulation. So I want to talk about sort of that fishing and simulation excellence. So a couple of things that I connect with these, two of my favorite things in the whole world of fishing and simulation, is that you have to identify mentors. The fish whisperer, which my husband knows a lot about fishing, but the sim whisperer, I would say that Chad would be my sim whisperer. And I still hear him talking to me and remembering some of the conversations we had. But I have mentors around the world and the country, and I really meet and chat with them in meetings that I'm on with SSH and Anaxel, but I also have a local community, and I learn so much from everyone else. We share ideas. So in simulation, as well as fishing, you establish your own community. You network with people to learn new and different ways and to get feedback. Also consider your own simulation practice and program. Just as with fishing, we have different modalities in simulation. We go after different things. We have different learners, different objectives, and outcomes. So it depends upon your program, sort of what tools and strategies you're going to use. Just like in fishing, depends upon where you're fishing. If you're in Colorado fly fishing, or you're further south in the Gulf of Mexico or in the Pacific or Atlantic Ocean. There's all different ways to fish and different fish that you're going to catch, but you have to have a different plan for each one. Now, the basics are the same across fishing. And I think with simulation, there are some pretty basic things. Those would be the standards that you have to consider as you are using simulation as well as fishing. I will have to say with simulation and fishing, patience. You have to have a lot of patience with both. And you have to realize that you're never going to be perfect, but you can strive to get better, do the best in implementation of your simulation. Many debriefings have gone awry for me, or the simulation wasn't quite what I expected, but we practice a lot, whether in fishing or in sim. The more practice you get, the better you become. And as you learn, and never forget to continue learning about everything you can about simulation, just as with fishing, we continually watch videos and work, and it's kind of fun to try new things, just like in simulation. I think being in simulation, learn all you can and be a lifelong learner. I think that's something that most of us in simulation want to do and always strive to do, and never accept the status quo. It's okay to try new things. And really reach out and see what other folks are doing and learning from them. And also finding the right tools. I think that is something that is very important for all of us. And so here I show you a picture of just one picture of one of my groups of folks that I work with in the simulation community. And that is one thing that's really important. So let's talk about the right tools. And I want to talk to you about the healthcare simulation standards of best practice. So this past year, Anaxel and the Anaxel Standards Committee really worked towards developing and revising the current simulation standards that we have, and also developing 2 new standards. This past year, with the support of the board from Anaxel, that led this initiative on rebranding and really re-envisioning the standard best practice. And so we have now retitled these as the Healthcare Simulation Standards of Best Practice, with the support and input of the global community. So we want these standards to be across all simulation communities. This is not just for nursing. These can be applied to any group, to any type of simulation within healthcare. And we hope that the rebranding is really going to help push this initiative around the world, as we have sought input from many groups and simulation communities around the world, from many professions that really had input into the standards of best practice. And while I had chaired this committee, I cannot thank this team enough. This was the Standards Committee for NACSL that really helped pull everything together in the midst of COVID. As you know, COVID slowed things down for us quite a bit due to our personal lives and work lives, but it was a team effort. There is no I in this. It's totally based upon the team. We also had quite a few subcommittee members and so many people to name that helped develop these. So I want to talk about the standards themselves right now. So here are our standards, and we actually have 2 new standards. Many of them underwent an overhaul, but we have developed 2 new ones, which are pre-briefing, preparation and briefing, and professional development. Sort of what I want to talk to you today about is kind of an overview of all of the standards, but where do you begin? Like, how do you start integrating these? As a novice or one as an expert, where do you begin to really operationalize these in your day-to-day practice? It can be daunting and overwhelming. And I'm hoping to give you a few tips today on how you might best, where do I begin? So this is where we're going to start today. So first, I want to talk to you about, still correlating fishing here, what are some anchors that we can use in simulation? I have to say, when you go fishing, you need something that keeps you on the spot, whether it's an anchor or trolling motor. You need some foundational things to guide your practice in simulation, but also it keeps you steady when you are fishing. So I often use a couple of these standards as my anchors. So to name a couple of these: professional integrity standard, operations, the new professional development standard, as well as the glossary and the SSH dictionary. I have to say those are some foundational things in really our working terminology. I know Dr. Leochi had already spoken on this week, and also the Healthcare Simulations Code of Ethics. And I really think that these are some foundational components to start with for new people that are involved in simulation. All of the standards stand alone, but as we go through today, you're going to learn that they're very interwoven, and so many of them reference other standards that they really are all connected together, but are separate standards within themselves. So I want to talk first about the professional integrity standard. And the criteria within this standard, of course: honor and uphold the Healthcare Simulations Code of Ethics, follow the standards of practice within your own profession, of course, create a respectful learning environment, and this is sort of cross-matched to the pre-briefing standard, the debriefing process, and also practice inclusion by respecting equity, diversity, and inclusivity among not just learners in simulation, but facilitators and content experts. Confidentiality, of course, is very important, related to their performance as well as the scenario. One thing about professional integrity, I used to begin novices with the simulation design standard, but I have changed it. I totally changed this summer, and where now I'm going to start all of my novice simulationists with professional integrity standard. I think this is where we need to begin as a community, as an organization, with the NACSL SSH. This is my personal belief that this is where it begins, that everyone really needs to work together and understand each other and include everyone within this standard, and post the Healthcare Simulations Code of Ethics on your wall. You can get posters of those. Soon we're going to have the symphographs of the professional integrity standard from the NACSL. Let's post that on our wall. I think there are ways that you can integrate this within your practice. Perhaps you have a lunch and learn with your new educators, or with all of your educators or your staff or your faculty within your simulation center, whether hospital or academics. Have everyone have a copy of this and have a conversation about how your team is going to uphold the professional integrity standard and the Healthcare Simulations Code of Ethics, which is integrated within that. I think that this is a very important standard that is sort of the foundation of our practice as simulationists. So next, I sort of consider the operations standard one as a foundational piece of simulation. Whether your program is 1 person, 10 people, or 20 people, I think really gaining a solid infrastructure is very important with your operations of your organization and integrating and implementing a great program. Criteria for this is to implement a strategic plan, provide personnel with expertise that's going to support, have a plan for managing space, equipment, and personnel. Now, I have to say, all of these things, are we all perfect with this? No. We tend to work hard at it every day, and we can just work to get better and learn from our group, for our community. Secure and manage financial resources. I think this is something we all struggle with, working towards sustainability. And I think this criteria is really important within your team. Perhaps when you go to a conference, attend some operations presentations to really work together within your team to implement the operation standard. Now, remember within the healthcare simulation standards that under each criteria are elements that help you achieve each of these criteria. And the standards, the revisions, and the new standards are in production now, should be published this month. We're keeping our fingers crossed, but it may be early October before these are actually published. So you're getting a sneak peek today of the revised and the new standards. So thinking of operations, take this standard and work within your team on how are you meeting these criteria? Do you have policies and procedures? Whether it's a 4 or 5 page document or whether it's a full 100-page policy and procedure manual, do you have those to guide you? So really thinking about this standard, work in chunks. This cannot be done in one night. You know, work as a team to make this happen. So I want to talk a little bit about the professional development standard. This is a new standard that was developed over the last 2 years by the committee. Of course, this was driven by the evidence and the literature review that was conducted by the committee. We had a medical librarian that really supported us in doing a deep dive into the literature and the research that has been out there. So this drove our 2 new standards, as well as the revisions that we have conducted on the previous standards. So the professional development standard, I will say that there was a large conversation, multiple discussion, hundreds of hours within the subcommittee led by Dr. Hallmark, Beth Hallmark, regarding professional development, because we didn't want to say faculty development or staff development, because I think this goes across quite a few different settings and applies to many people. So as you know, the terminology changes over time, and I think we're really getting closer to a common terminology. So we chose the term professional development for this standard. So the criteria to meet this standard, there are 3 global criteria to meet the standard. And one thing within this standard is that as you begin as a simulationist, you need to do your own educational needs assessment that performs a gap analysis that will provide a foundation for a plan. And what will your professional development plan be? Also participating in activities that address your learning outcomes and will align with your role. Because we know that different simulation educators or faculty can be different within different institutions, and the titles can vary right now. So really thinking about what activities, training programs can address your learning needs and outcomes. So this is important to get some training, to learn more, but also do a reevaluation or reflection on that plan on a regular basis. I think you need to be receiving feedback, formative and summative ways, using different tools. For instance, there's lots of tools out there that facilitate a rubric. Other ways that you can receive feedback, whether from a peer or having mentors work with you, or maybe you're the one mentoring other folks, still receiving feedback. So remember, there's conferences such as this, presentations, and so many different things that we can use to get better as a simulationist. So is this going to happen overnight? No, it's not. But really taking a look at where you are in your career as an educator, as a simulationist, and using different ways to determine, are you where you need to be? Using the CHESI, the CHSE blueprint. There has been several articles published over the last couple of years related to professional development. Dig into the literature, like, what do you need to get better? And so there will be a great reference list with the standard when it's published, and we'll give you some other ideas on where to search for that. So one thing we know is, why are words important? I'm not going to spend too much time on this because I believe Dr. Leochi has spoken on this, but we, as a simulation standards committee, even though we still have a glossary, there was a debate over, do we keep this or not? But I think it has really been honed down. And I think in the next iteration of the standards, I anticipate, of course, can't confirm, but I believe we will hopefully merge towards just using the healthcare simulation dictionary as support for that. We know that words are important. And as we grow as a community, really streamlining the terminology and getting a universal language is important. So I think these are some other anchors of ours as well. The dictionary and the terminology is really important for a simulationist. Now, thinking about fishing, I've already talked about anchors, and that you have to have a foundation, whether with fishing, but in simulation, what are your foundation? And I named 3 standards that I think could be your anchors for your simulation program. Now let's talk your tackle box with different hooks. And I never knew there were so many hooks and weight sizes and sizes of weights and lures when I started fishing. It's amazing. Same thing with simulation. There's so many modalities. There's so many different ways that you can do simulation. And there's different tools out there to support this. So a few of the tools that I'm going to talk about are some of the other healthcare standards of best practice. And I sort of listed some here that I'm going to briefly talk about, how you can put that in your back pocket and use these as tools as you go through. So outcomes and objectives, I think, really guide your simulation and affect your curricular and programmatic needs, and really identifying the correct modality, fidelity, and facilitation strategies to really achieve the results you want, considering the level of the learner. And that's something we need to consider. Are they early learners in an academic setting? Are they staff nurses or physicians or surgeons? You know, really creating learner outcomes as well as objectives for that experience. And is it a formative or a summative type evaluation? Do we have the right modality that's going to meet the objectives or outcomes? The fidelity, what level of fidelity do you really need to meet those learning objectives and outcomes? So using this standard is a great way to sort of guide you as you begin designing your simulation and really thinking about, where am I now? Where do I want my learners to be? Where do I want the participants in the simulation to be at the end of this simulation? What do I want them to gain from this? Also, with outcomes and objectives, we're going to determine sort of that facilitation of the simulation experience to meet those objectives. And we'll talk about facilitation again in a minute. Again, these sort of are cross-matched and reference each other very nicely. So simulation design is sort of one of the go-tos for me with novices. And so I would probably start anyone out after professional integrity and really considering the operations standard as well, thinking about the simulation design standard. So within this standard, we sort of give a step-by-step of designing your simulation experience. And within this, we reference multiple standards within this. So, and we'll talk briefly as we go through the criteria. So first, the experiences need to be designed in consultation with content experts and simulationists. We started with this one because we think everyone needs some training, some type of education within simulation, pedagogy, and practice. And we know that people have to start somewhere. So really working with someone that does have some experience and some knowledge is very important in designing simulation. So if you don't have that at your program or your center, reach out. There's so many programs, mentoring and mentee programs within SSH, Anaxel, and there's other organizations around the country and the world that can help with this. Next is performing a needs assessment to know, why are we doing this simulation? Is it I just like coding patients, or is it really deeply embedded within the curriculum on what is driving the simulation? Developing objectives and outcomes, again, that are going to guide your simulation design. Those are so important as you begin developing your experience, because that's going to connect your pre-briefing, your simulation design, your debriefing, and ultimately the outcomes you want for your learners. We also want to align the modality with the objectives. And within this standard, remember, under each of these criteria are elements that are going to help support each of the criteria. So I'm only kind of giving you the overview version of these standards, okay? So thinking about aligning the modality and developing that case or scenario or activity, if it's a procedural simulation, what's going to provide the context, the concept for you in this experience? And we always want to achieve perception of realism for our learners and the required realism that you need within this to get your learners to where you want them to be, using different types of fidelity. Also, planning a learner-centered facilitative approach driven by, again, the objectives, the learner's knowledge and where they are in their training or their career, and also the expected outcomes. How much influence will a facilitator have? Will it be more student-centered, facilitator-driven? That's something that you will need to decide for your program. Also, we want to create a pre-briefing plan as well as a debriefing plan. And this is really sort of started within the simulation design process. And we'll talk more about those as we get to those standards as well. So within the simulation design standard, you notice each criteria sort of driven and guided by another standard. So develop your pre-briefing and debriefing, and you also want to develop a plan for evaluation of the learner, and we have a standard on evaluating the learner. Whether it's a tool, whether it's an informative type expectations for their behavior within that experience. But we also want you to consider evaluation of that experience. And this really leads into the quality improvement process. How are you evaluating that experience? Not just from the learners, but from the facilitators, the content experts, from the simulation team, the operations specialists, how we have really evaluated that entire process, the entire program after each experience. Are we looping that back into our design and doing better for each iteration of that experience? And also, this is something I can't stress enough, is pilot testing your simulation. And sometimes after you've done simulations quite a bit repetitively, you don't always, I think, have to do a full run through, but we even will do some walkthroughs or talk-throughs with some that we have done for 5 or 6 years that are pretty standard for us. But I can't tell you how important it is to do this. And within that criteria, there are some other elements to consider as you are doing that. Now, another new standard that has been developed, Donna McDermott led the standard development for this pre-briefing, preparation, and briefing standard. So one thing about this standard is that we know that pre-briefing really sets the learners up for success, right? That is so important. And there's sometimes multiple levels of the pre-briefing. So within this standard, there's 2 overall criteria: that the simulation should be knowledgeable about the scenario and concepts related to pre-briefing, and it should be really developed according to the purpose and learning objectives of the experience. Also, there's 3. The experience and knowledge level of the learner should be considered when planning the pre-briefing. So there's 2 other levels of criteria to consider: the preparation as well as the briefing. So preparation criteria, depending upon your simulation, developing materials to be sure that they are prepared and can meet those learning objectives, depending upon your experience. Preparing materials for prior to, if they have prep work before they come, as well as for day of the simulation experience. For the briefing criteria, usually for the day of the simulation, maybe you have a video pre-briefing, and then you do just-in-time briefing on the day. Expectations that for the learners, the agenda, logistical things for them to know prior to the event. Also, do you have an orientation to the environment? And probably most importantly is establishing the psychologically safe environment. And of course, there are several ways to do this. And within these criteria, again, are elements that you need to consider in securing that you are actually implementing these criteria according to the standard. Posting the basic assumption on the wall. Using the standard meeting with your team and meeting with different groups. We have graduate nursing and we have undergraduate nursing. So our pre-briefing and our preparation and briefing strategies are a little bit different for those. So we are really looking at taking this standard when it's published and looking together as our team, our simulation team, and how we're going to actually implement this standard. So I think it's important to take this standard, have lunch one day, invite different groups to come in and say, are we meeting this? And just go down the criteria. How can we do better in this aspect? So those are some things that might help you actually implement this. Now, the debriefing process standard, I believe, really took an overhaul under the leadership of Dr. Sharon Decker. And within this standard, we really looked at all of the modalities that we have, whether it's virtual, standardized patient, mannequin-based, whatever it might be, and considering the debriefing process. So making sure that you have planned and incorporated into this experience, guiding that learner in achieving the desired learning and evaluation outcomes. So how are you in the debriefing process and realm going to help them ensure that they've learned what we wanted them to learn? It should be constructed and designed by someone or a system capable or competent in providing feedback, debriefing, and or guided reflection. So these are some components that have been added to really make this a robust standard related to giving feedback, as well as guided reflection, because this might look different for a virtual simulation or computer-based simulation. This also should be conducted in a manner that promotes self-team and our systems analysis. It should really encourage reflection. The learner should be able to reflect in some way. Also closing performance gaps or performance and system deficits while maintaining psychological safety and confidentiality. And of course, this should be planned and structured in a purposeful way based upon a framework or evidence-based concept. So this standard within there outlines a few of the debriefing models and frameworks that are out there. There are many that can be used in planning your debriefing process. Also considering with debriefing awareness of the diversity of participants and how SBEs are going to impact their learning, and ensuring that we as a simulationist are displaying behaviors of genuine mutual respect, actually role modeling the behavior for our learners, creating a partnership in learning. And I do think implementing the standard, what are some things you can do? I think, again, working with your team, working with your content experts in analyzing your current debriefing process. How are you giving feedback? What is your evaluation of those actually doing and implementing debriefing? Because we use quite a few different debriefers. Having some time to sit down and go through, are we meeting these criteria and the elements underneath it? And it's just taking time to sort of dig in to this standard. Okay, next I want to talk about the facilitation standard. And I think that facilitation differs at different facilities for different groups, hospital-based simulation versus academic. And I think it's pretty much focused on to the level of the learner and what are the outcomes as well. So the people that are facilitating are those that are facilitating a simulation experience from beginning to end, and there may be different people doing this. They have to have specific skills and knowledge in simulation pedagogy, and they absolutely need to follow the SSH, Healthcare Simulations Code of Ethics, the Professional Integrity Standard, also following the standards for simulation design, pre-briefing, debriefing. So those are all integrated within the facilitation standard. Of course, the level of facilitation is going to depend upon your level of learning and experience and the competency of the participants. Methods used during the experience involve the delivery of cues. And I think that's important is this a high stakes or summative or formative? How are you going to ensure delivery of cues being standardized across the experiences. Also, facilitation is not just during the simulation or even during debriefing. I think it extends beyond that in helping support our learners in achieving their expected outcomes. And this includes pre-briefing and preparing the learners for the experience. And in considering how to actually implement the facilitation standard, I think it's working with those facilitators in your program and going through this standard sort of step by step. And are we meeting this? Are we doing this? And there are a few rubrics that are out there that can be used in evaluating facilitation. And it's something I think that, you know, we should begin really looking at in our simulation experiences. Next is evaluation. And with evaluation, I think it's important that we determine the method of learner evaluation before the experience. Of course, our experiences are going to be formative evaluations. So it's going to be, are they learning what we want them to be learning at this point in time in their program, whether it's an academic curriculum or it's in a hospital-based setting. Also summative. So are the learners at the end of a program or end of a session or end of a course, do they meet the expectations that we set out for them? Are they meeting the outcomes that we have planned for this simulation experience? Of course, you can also, for simulation, it can be a high stakes evaluation experience for the learners. Some OSCEs are also high stakes simulation experiences as well. So really considering your level of evaluation for the learner is very important. All right, so next, considering interprofessional education. And I think this really is important for the SSH community because we are an interprofessional group. And I think more simulation is really focusing on IPE. And this was led by Dr. Kelly Rossler, lead of this committee, is really establishing a theoretical or conceptual framework upon which you are basing this on. What theory? Kolb's experiential learning. You know, what are you going to base your work on interprofessionally? Also utilizing best practices and design of SIM IPE. And under this criteria are several elements that speak to best practices within SIM IPE. A couple are developing mutual objectives, like the IPE team should be working together to develop these experiences. It should not just be the nursing group or the physician group or the respiratory group. All people, all professions involved should be working together to develop and design this IPE. Also recognizing and addressing any barriers to SIM IPE. I know at our facility, we struggle with curriculum and different groups. They have to go to clinic at this time, and nursing students are in clinical and can't miss clinical. So it does take a lot of perseverance and really recognizing the potential barriers to SIM IPE. But I also think it's an open and transparent conversation with the other professions, and how are we going to move past some of these barriers and work together and compromise to really make SIM IPE happen. Of course, you always need to develop an appropriate evaluation plan, and there's several tools and things out there that can help with this, but always from a team approach, really looking back, whether it's from the SIM team that put this on with the content experts, what worked and what didn't, sort of doing their own debrief and evaluation, because all what we're doing is considering the quality and excellence, how we're going to get better next time. I'm always thinking of next time we need to do this, and next time. One thing with SIM IPE standard is really role modeling for our learners across a co-debriefing situation or multiple content experts. If we disagree during a debriefing, how do we handle that as professionals, and really role modeling techniques and strategies to overcome some of that within our simulation experiences. So what's next? So, and I know these words are a little bit small, I'll go through these, but what's next for everyone that is involved in simulation? What's our action plan, and how do we take all of these standards and really consider ways to operationalize them? Because I know as a novice person coming into simulation, and many of you out there right now may be novices or consider yourself novice and not an expert or not an intermediate type level of simulationist, but What's next? And I think it's an action plan. It's very daunting. And when you print all of these out and you have your packet of standards, you go, wow, where do I begin with all of these things? And so I have a few tips, and these are my own personal ideas and thoughts is, sit down and make a plan, get your team together, whether that's your team of 1, 2, or 10, and think about where are these standards going to take you and where should I start? Perhaps you start with something that you're already doing well. And if you think you're doing debriefing well, pull a debriefing standard out. Go through it and saying, hey, am I meeting the mark on this? Okay, these are things we can do better next time, or maybe we need to do some just-in-time training for some people. So pulling that standard down. Like I said, when I first started, I think the basic anchors for me would be the professional integrity standard, the operations standard, as well as the professional development. But taking each standard and just sort of breaking it down. So engage your team. Maybe if you have a team of 5 or 6 people, each team member can really go through the standard, read it, and get familiar with it and present it. When you teach something, you tend to be better at it. So taking that standard and maybe having a lunch and learn, or having a 1 hour a month meeting and each person present a standard, and the team talking about, okay, we're meeting this, I think we're meeting this. And really figuring out where are you within that standard and what are your areas for improvement, and then developing a plan to get better in those areas. Now, will you ever be perfect, and will you always be able to 100% meet this? Not always. COVID last year, as you know, really changed the way we practiced, and we had to adjust what we did in implementing simulation experiences for our learners. And so thinking, last year I went, how do we keep the standards? And we're all virtual now, or using Zoom, or doing all kinds of different things. So really kind of integrating your team in that process. Also, as I said, determining your anchors, and it may be different for you. Sort of what are you going to start with? If this is daunting, the whole pack, pick one, and take a couple of months and really work on that standard. Also, stock your toolbox. I think there are so many resources out there, it's almost overwhelming. But really pull some things, not just the standards, but pull some things that you can put into your toolbox that you can use. Create a notebook for your faculty. Also, if you have questions, reach out to the standards committee member. I know I get emails. People will email an Axel, and they'll email me and say, hey, could you touch base with, Jane at so-and-so simulation program, they have a question about this. And if I go, wow, I'm not quite sure, let me call Sharon, or let me call Donna. And I know that they're more familiar with this. And so I really try to network people in helping people get answers to different things. I also recommend SSH. If you contact them, they're going to put you in contact with someone that might have better information on that standard or on this problem or process that you're struggling with. And Axel, your community, look at your regional alliances and consortiums for information as well. And speaking of the alliances and consortiums, I think it's important to develop your community of practice or learning. I know Janice Palaganas may be listening today, and I know a lot of her work is in this, but developing your network. I have a group of simulation folks that I will talk to daily on the phone for 10 minutes, or I'm texting about, man, I've had a rough day, I don't know how to handle this. And we help each other and support each other. And I think it's important to network with people within your area and your region, or even a virtual group. I've sort of started this after a training program I did back in August. I have a virtual group I've gotten together about every other month. We get together and just talk about what's going on and how can we do better. And man, I tried this and it didn't work, because that's how we get better, is we work as a community to get better. Also with the standards, kind of moving forward, is starting small and chunking the work. Maybe you have a small retreat, maybe it's a couple of hours, you go to a local coffee shop, or you get some of your simulation committee or your advisory council to come together and say, let's dig through a couple of these standards, because I think it's going to guide our strategic planning process. Or I know that we've really been struggling in our evaluations, that we have not really scored very high in pre-briefing. So I really want to pull out that pre-briefing standard to see where can we do better, and let's pull in the evaluation data so that we can get better. Like I said, focusing on one standard, maybe dividing it up amongst your team. Also, I was looking through a couple of my books and resources that I had, and I came across Colette Foisey-Dahl and Kim Layton's book on simulation champions. And I found that there is a checklist of the standards. I've kind of done a quick snippet on your screen there. They have in one of the electronic resources a review tool for evaluating the design and implementation of simulation. So they actually have a list of the standards and the criteria, and are you meeting it? And on the right-hand side, it's like ideas for revision. And so really this might be a way that you could go through and make your own checklist. I mean, this was from 2018, but you could make your own checklist that you could keep documented on how well are you meeting those standards. We have so many resources available to us. So I challenge you to find and network, and I think Healthcare Simulation Week has highlighted so many of those resources. But again, there's a Defining Excellence in Simulation Program book, SSH and NACSL. There's ASPE for standardized patient standards of best practice as well. There are other simulation groups and books and journal articles around the world. And we as a simulation community, we are one, and we're going to support each other. And I think that's really what resonates with me, is that we are one as a community and we do support each other. So as I'm kind of wrapping up, and I've hopefully given you a few tools and ideas on integrating and applying the standards of best practice. I spent a lot of time on these with our committee and subcommittee members over the past 2 years. And I've learned a lot, but every day I read one and I went, man, I don't remember that. So I challenge you to dig into these and figure out how you can use these in your practice. Now, I will say that these are being published, and, original drafts were out in January and February. There's so much literature out there right now that revisions will come in the next couple of years, because these are living documents. And I think that over time, we're seeing some of them becoming pretty static. They're pretty standard. But with COVID, the pandemic, people really challenging us in how we're implementing simulation has really driven some of the creativity within our programs. And I see some of the standards kind of changing related to our practice. And that's part of having the standards of best practice. Now, as I start to wrap up, I really want you to think about your why and why you want to strive for excellence in quality and simulation. And this is my why. So this is a picture of our family at a Christmas party. It's my husband, and I have 3 children, and 2 are married. And I have one nurse right there in the middle, the blonde Natalie, the only other healthcare person in my little tribe. But what is your why for excellence in quality and simulation? And I often think of my family, but I also think of Dr. Chad Epps, always pushing me to think beyond what we do every day in the status quo. And I think this drives for why. And I also think this is my son, Thomas, who actually at birth had transposition of the great vessels. Now as a nurse, I know that, it's transposition. This is it's easy fix. 25 years ago when he was born, they'd really developed some new techniques. So we were very fortunate for Thomas that happened. But he's also my son that's had, some surgeries from broken arms. And then he had Hodgkin's lymphoma 3 or 4 years ago as well. And here's a picture of him getting chemo at the Kirkland Clinic at UAB. And so this is my why. And not just being a simulationist, but being a mom of my kids and seeing healthcare from a different perspective and walking in our patients' shoes. And you turn into someone different, because being a nurse and a simulationist, but a patient and a patient's mother, it really changes your perspective. And I really want us to think about our practice of simulation, and why do I work really hard about simulation? Because I know it makes for better practice, and I think it really supports patient safety and quality in our healthcare settings. And I know our community is pushing and striving for that as we move along. But I want us to kind of think now about your why, and what is something that you would want to aim for in your practice and change. And so this is a view. This is on the bay at Wolf Bay right off the Gulf of Mexico in Orange Beach, Alabama. And I want you to kind of think about this picture, because this is where I do a lot of reflection and thinking about things. Just reflect for a minute on your practice and how are you achieving excellence and quality in your practice and really ensuring what your work is about, and what are you about, and what are going to be your next steps in achieving excellence and quality within your program, with your own personal practice. And I think that Chad was always one that pushed me and our team, and I know his team at Tennessee, at UT and Memphis as well. And I learned a term from Chad a few years ago, and I'm not sure if he coined the term or he stole the term, but I learned it from him initially. But Chad always talked about the golden nugget of what you have learned and how will you continue to strive towards excellence and quality. And not just what do our learners learn. And I use this term at the end of debriefing as I want to go around and do one takeaway from each person. I need one golden nugget. And even when we did our debriefing of the debriefer, our D to Ds, he would talk about there were some golden nuggets handed to you in that simulation experience and during that debriefing. And are you capitalizing on those golden nuggets, which are so vital and important? And I want us to think about today, as we're kind of wrapping up simulation week, is what is our golden nugget of what we have learned this week? And how are we as simulationists really going to continue striving towards excellence in simulation and simulation quality? Thank you, and I'm looking forward to some questions.
You can post your questions in the chat if you prefer.
Also, Cynthia, I wanted everyone to know, thank you for coming today, that people have asked about the PowerPoints, and I will be able to get a set ready, a PDF of that for Curtis to put on the website whenever the presentations go up. So I'll be glad to do that.
Hi, Penny, it's Julie.
Hi, Julie.
Good morning. Well, good morning, California.
Yeah.
Great presentation. Very heartfelt, and it's great to see the standards progressing. I mean, it just shows the maturation of the field. And as we're getting more and more literature to support our work, and Axel has done an amazing job of providing us really all the references for the why. And I applaud your efforts. I was part of the operations, the first round, as you know, and that work was great. I mean, it was so wonderful to work across disciplines and really provide additional support for people that are, interested in going for accreditation, certification, or just getting more information about how do I really do this? Because it seems like it's, and as I've seen in many reviews, it's less and less the Wild West out there. And it's the work of Axel, SSH, ASPE, and all our affiliates that have really helped us refine what we do and how we do it. So I applaud all the efforts that Axel has done on this work.
I do think it was a team effort from around the world, interprofessional. And I think the next time as we go through some revisions in the process and we'll have a bigger group looking at these. And I think the work by this community has been fabulous. And the last year or two, I think so many things changed and happened for the simulation world. It's really going to drive, I think, some new things in the future as well. So yeah, it's exciting.
It is. You're right. Yeah, the pivoting that we have to do is a science in and of itself. I think it's going to come a new term: pivot science of pivoting. And how does one do it? How did one turn on a dime? Hey, I just coined a new term. I get credit for it. Just kidding. Anyway,
that's right. That's right. We'll give that to you, or we'll have a standard how to pivot.
You got to publish it. Yes. Hi, Lori. Anyway. So yes, thank you again. Great job.
Hey, Penny.
Yes. Dr. Leochi's a problem, I see.
I am, and I'm supposed to be a technology guru, right? Like that. Hey, so I just had a question for you. Can you tell us a little bit about how each committee worked to vet the new standards?
Yes,
a little bit about it. It would be great to share it with everybody.
Absolutely. So there is a process within the bylaws about how we're to vet each one. There was a membership survey conducted a couple of years ago, as well as we had a healthcare medical librarian with us that helped search the literature, a systematic review. And with all of that information, each subcommittee went to work looking at the literature, comparing, seeing what was out there with that help. And once we drafted revisions and so forth, they were sent out to expert reviewers, which were former presidents of ANACSL, different people to kind of look and review, were we missing something? And then as we finalized those drafts, it went out to the advisory council, as we called it, which was around 25 organizations around the world. And we're hoping to get more next year, to give their perspective from their organizations, and got really good feedback on how to really make this interprofessional and international and apply to all realms of simulation. So COVID didn't help us. It postponed us just a little bit, but that's a quick snippet since I know our time is running short. Does that help, Dr. Leochi, my fishing friend?
Yeah, thank you. I know it's amazing the process y'all go through, and so I know that's
well. I have to think I follow Dr. Barb Sittner, Dr. Kim Layton, and others before us, and they did, and you and everybody else that did the foundational work developing these. We're just following in some great footsteps and have had a lot of help and support. So
we can't wait to read them.
Well, we're hoping this month, first of next month. They're kind of in the publisher's hands right now. So. I had a few fishing friends log in on here and privately saying that we need to go fishing. So I'm all about wherever you guys want to go. Any other questions?
I believe we've answered all the questions in chat.
Okay. And I will also put my email. You may have it. I will put it in the chat box in case you have questions, or I can get you in contact with someone that may have more information on something. So anyway, thanks all, and happy Simulation Week.
Thank you very much.
Thanks. Take care.
Thanks, everyone.
Bye.